us dive into the perplexity of urinary tract infection and, as usual, uncover the real causes behind it. Up to 50 to 60% of adult women will experience at least one episode of urinary tract infection in their lifetime. Yes, that is to tell you that it is relatively a common condition. So if you're wondering why you have a UTI or why it keeps coming back, you are not alone. What exactly is a urinary tract infection? This is an infection that occurs in the urinary system, which includes your ureter, your urethra, your bladder, and the kidneys. All right, and most urinary tract infections are caused by bacterial microbes, with E. coli being the most common cause of this condition. Other bacterial microbes that could cause this condition include Klebsiella pneumonia, Proteus mirabilis, Enterococcus faecalis, Staphylococcus saprophyticus, Pseudomonas aeruginosa, which is usually hospital related, amongst other causes, which could be fungi sometimes and sometimes a virus as well, but the most common cause are bacterial microbes. Don't worry, with time I will be bringing the slides of anyone isolate so that it can better appreciate it. So in today's video, we'll be looking at urinary tract infection in general, its causes, the symptoms you might be experiencing, the exact diagnostic procedure to pin this down, and then most importantly, I'm going to be telling you the do's and the don'ts so that you don't come down with one, and if you've come down with one previously, so that you can prevent its reoccurrence. So what are the symptoms of urinary tract infection? They include 1. Pain or burning sensation while urinating, frequent urge to urinate, with most times urinating very little, sudden urge to urinate, you're pressed and suddenly you want to urinate, just sudden, all of a sudden you get the urge to urinate, even at night. Another is lower abdominal pain and also pain just right under the ribs. Another is bloody urine that is caused by schistosomal hematoma. That is the cause of that particular one. And then urinary incontinence. Urinary incontinence is uncontrolled passage of urine, uncontrolled leakage of urine. It is not just urinary tract infection that causes this. It is mostly caused when the pelvic floor muscles become weak. All right, there are a lot of causes of urinary incontinence, which urinary tract infection is one of them. But if you're leaking urine, if you leak urine unintentionally, maybe when you cough or you want to urinate, you're running to the toilet and all of a sudden you're already pouring the urine on your body, yes, urinary tract infection is one of the causes, but it is not the only cause. Try doing Kegel exercise to try to control your pelvic floor muscles, to try to strengthen the muscles down there. It could help, and if it continues amongst other symptoms, then it is urinary tract infection. Also, urinary tract infection, though occasionally it could present with fever. All right, so prevention of urinary tract infection. How do you prevent this from happening in the first place, or how do you prevent this from reoccurring if you've gotten one before? Of course, there are a couple of things you can do to prevent this from happening or from reoccurring. All right, and one of them is, firstly, wipe from front to back. After using the toilet, wipe from front to back, not from back to front. This is to help to prevent the introduction of poo or feces from your anus into your vagina and then into the urethra. All right, because when you wipe that way, you're doing the opposite. The right thing to do is to wipe from front to back to minimize the introduction of poo, because if you're opportunity to see feces or your poo in a microscope, you will see that is not clean. There are a lot of things that are found there which are normal. All right, but we are not supposed to be seeing it into the urethra. Once it is introduced into the urethra, you're going to have a urinary tract infection if you don't take the other necessary steps you're supposed to take. So don't even allow it to get into your urethra in the first place. All right, so number 2, drink plenty of water. Try as much as possible to stay hydrated. I have a video in my channel where I have highlighted so many health benefits of staying hydrated, so many health benefits of drinking water. The video I tagged top 16 healthy habits to a healthier you, a happier you. Drink plenty of water. This will enable you to empty your bladder regularly and frequently, so that is there anything that has found its way into your urethra and unfortunately found its way into the bladder again, it's going to, the frequent urination is going to help dislodge it. So drink plenty of water, drink plenty of fluids, stay hydrated. Another is try to urinate immediately after intercourse. All right, the vagina, you and I know that there are a lot of normal floras that are there. Is there any way that it has found itself into, because the women, we have short urethra, things can easily get introduced into the urethra. So urinate immediately after intercourse. This is going to help you to dislodge any microorganism that has found itself into your urethra, which will ultimately travel up to your bladder and the rest of them. All right, so wash your vagina before and after intercourse, just with plain water, with clean water. You don't need all those, let me not mention, you don't need any products to keep that place clean. Just wash with plain water before and after intercourse. This is also to prevent the introduction of normal floras that are found in the vagina into your urethra that would go there and cause you an infection. All right, so take a shower. I mean, instead of a bathtub, most people prefer to go into the bathtub, be it hot bathtub or anything. Studies have shown that taking a shower will help you minimize and abate that risk of getting urinary tract infection. Shower instead of sitting in a bathtub. All right, also talk to your doctor about cranberry juices and tablets. There are some juices and tablets that are called cranberry. This can help you prevent it, but I don't advise people taking drugs or supplements on their own without seeking their doctor's advice first. So on your next appointment, tell your doctor you heard about cranberry, how safe is it for you, so that you will know if he will recommend it for you. All right, so what are the things you don't need to do to make sure that you prevent this from happening and from reoccurring? The first thing is wash. Do not wash your vagina, wash your vulva instead. The vagina is like a muscular tube that connects your uterus or your womb to the outside of the world. It is self-cleansing. It does not need to be washed. Instead, wash your vulva. The vulva is the surrounding areas of the vagina. I think I've said this enough. It's time I made a separate video on the right way to wash your vagina, and also I'll expose you to the different parts of your vagina, so that when I talk about the labia majora, you know what I'm talking about. If I talk about the labia minora, talk about the vulva, if I talk about the clitoris, you know exactly where they are. All right, so but in the meantime, do not wash your vagina, wash the surrounding instead, and it has to be with plain water. Another is, do not attempt to hold urine. I know sometimes it could be unavoidable, maybe you're traveling or something, but just know that it is the wrong thing to do. Do not hold back urine. Empty your bladder as soon as you're pressed. This is going to help you. Is there any bacteria that has found itself in your urethra and then in your bladder? Do not allow it to continue multiplying or to tag itself into the new environment. Dislodge it by urinating as soon as you feel the urge to urinate. Another is, do not wear tight fitting and nylon underwears. Instead, wear loose fitting cotton underwears. Nylon underwears or tight underwears could make you retain moisture in that area, whereas when your underwear is loose and they are made of cotton, it helps the place to be dry and quite airy, thereby preventing the multiplicity of microorganisms if unfortunately they get in that area. Another is alcohol. Do not take excessive intake of alcohol. Is not recommended for any reason. All right, they could get your bladder irritated, thereby encouraging the growth of these microorganisms if they unfortunately find themselves in that area. I have a separate video, same top 16 healthy habits, where I talked about the WHO recommended limit for alcohol. There's a level that if you exceed it, you are now tagged as taking alcohol excessively, because there is what is called the normal limit of taking alcohol. All right, another is, do not use spermicidal loops, condoms that contain spermicidal loops. Try non-spermicidal loops condoms. They are clearly written on the labels of these condoms. Also, do not take excessive sugar intake. Is not recommended, as it could encourage bacterial growth. Sugar is a good culture media that encourages the growth of bacteria, so excessive intake of sugar is a no-no. All right, so what is the diagnosis? What is the right way? How do you diagnose this condition? You're having all these symptoms that we've talked about, burning sensation and all the rest of them. How do you know? Because you can't keep guessing. You need to get tested. All right, so how do you diagnose it? What is the definite test for diagnosing this condition? It is called urine MCS for sure. That is urine microscopy culture and sensitivity. Here, the laboratory is going to provide you with a clean container that you're going to use to get midstream urine. You don't just urinate into the container. Allow some amount of urine to pass out before. That is why it's called midstream. And then you produce the following urine. That is to make sure that is there anything that is not coming from your bladder directly, so that you don't get urine that has washed off the particles that are in the vagina and present it to us as your sample. You need to produce midstream urine, which is gotten by urinating some amounts of urine out first and then bottle the remaining urine. So during this test, your med lab scientist gets to view your urine to check for any form of parasite that could be causing you this urinary tract infection, which is usually Trichomonas vaginalis. You can see that in the parasite. When you view, you could see that just by mere microscopy. At the end of this, you now subject the urine to 24 hours of culture. All right, so that is there anything that is inhabiting that area, you under that 7 degrees centigrade, which is the normal body temperature, this bacteria will definitely have to grow if there is one that is inhabiting the urinary system. All right, so when it does grow, you now subject it to antimicrobial sensitivity. Here you are able to pin down the particular or the correct antibiotics that will best clear out this infection. All these things are done in the laboratory. All right, watching up to this moment, then it's time to give this video a thumbs up, hit on that subscribe button so you're going to follow for more. Okay, urinary tract infection is a relatively common condition in women, and you can see that over half of women will experience this at least once in their lifetime. And with pregnancy and the state of your immune system, further increasing your chances of coming down with this infection. So reducing the risk of urinary tract infection is all about self-awareness, maintaining proper hygiene, and implementing some of the basic lifestyle changes as stated in this video. Okay, so anytime you're experiencing a symptom, do not feel withdrawn. Get a doctor, get tested, and get treated. All right, so do you have any personal experience or any experience at all? Please share your thoughts, tell me anything, how you feel about this, so that I know I wasn't just talking to myself, we actually communicated. Let me know what you think in the comment section. All right, and please subscribe so that you encourage me to keep producing more of contents like this, and I'll see you in my next video. Thank you.